Hi, my name's Karin Patterson. I'm an osteopathic family physician. I practice family medicine in Northwest Indiana through St. Mary Medical Center.
Hi, I'm Oney. I'm a family nurse practitioner and a clinical nurse specialist in women's health. St. Mary Medical Center employs both Dr. Patterson and myself, and I collaborate in practice with Dr. Patterson, and they've been very supportive in the use of functional, regenerative, integrative medicine.
This is integrative medicine, but I don't really see it as alternative to traditional because I think it's going back and looking at restoring natural physiology. And so we are tailoring medicine to a more individual approach. So looking at each patient's deficiencies or symptoms and what we can kind of replete without using one dose or one pill for everybody. My main kind of philosophy of medicine is to support prevention of disease and supporting your body's own immune system and looking at the risks that may, ultimately develop into some kind of disease ailment such as cardiovascular disease, and kind of optimizing the risks prior to it becoming a problem. So convincing people that their blood pressure that's elevated, even though they don't feel bad, will ultimately, likely have a bad outcome for them if we can't deal with it before we get to that point. So prevention is kind of, I guess, my main philosophy.
Usually we start out looking at what is their chief complaint, maybe the top two, and then in my mind I start right away looking through the functional medicine matrix and what kind of inputs are there. What sort of bad things do we need to take out of their lifestyle? What kind of good things could we put in that aren't there? How is the gut? What is the issue? Is there an absorption problem? Is there the potential for a parasite there? What kind of nutrition do they get on a regular basis? I almost always ask for a quick 24-hour dietary history, and that gives me a clue right then by looking at the functional medicine matrix as to where's our problem. I like to detox the liver, clean out the colon, get rid of some of those bad things. I'll look at food sensitivities. I may do a stool analysis and then go ahead and put back what we need. What nutrients do they do? I don't do any oral chelation at this time. I don't do any IV chelation at this time, and I have found that I haven't needed to. We've gotten rid of heavy metals. We've gotten rid of some of the fatty livers. We've done some fabulous things with the gut in terms of irritable bowel syndrome. Over a dozen patients that have done the stool test, I've only had one that didn't have a parasite. So we treat that, and that takes care of a lot of things then too. That can be a reason for depression. That can be the IBS, insomnia. One of our biggest successes has been with some food sensitivities as well. We've had a number of skin patients, respiratory kind of issues, and when we have tested for and pulled out the offending foods, we see a great deal of symptom relief and reduction in the need for medications too. I've been in women's health for probably over 10 to 15 years now, so I have quite a regular population of females that seek care with me, and we're all in that perimenopausal, menopausal age primarily. So I see a lot of the issues that are associated with that. I routinely look at adrenal health because it does impact the hormonal symphony, and then I will specifically look at sex steroid hormones, test for those in a salivary manner, and then we replenish through a compounding pharmacy that is local in our county. We use bioidentical hormones. The bioidenticals are different than the synthetics, transdermal estrogens and natural progesterones. I utilize topical testosterones in women with libido issues if it is called for to be replaced. We don't replace what isn't missing, and we don't replace to a fertility level in menopausal women, we replace to a functional level. Balance is the key. So getting them balanced allows me to use a lot lower doses than maybe other practices utilize or synthetic hormones require. If you'd like to know more or have a consultative appointment, you can feel free to give our clinic a call, 219-663-4007.